Knock, knock.
Come in.
Hi, my name is Thalia. I'm going to be your nurse for today. Can you just verify your name and date of birth for me?
Robert Valentine, 1967.
Do you mind if I take a seat?
Not at all.
Okay, so I'm here concerning your new prescribed medication. I just wanted to educate you a little further on it and do an education process with you.
Okay.
Is right now a good time for you?
Sure.
Okay, I know it's a little loud in here. Do you want to move to a more quiet, private room?
Yes, please.
Okay, just follow me. Okay, so regarding the medication that you are currently on, I know that you are on aspirin 81 milligrams a day oral, and you are also on Plavix 75 milligrams a day oral, and both of those medications are for artery blockages.
Yes.
You were on metformin, but you are no currently that has been discontinued, that medication.
Okay.
You are on lisinopril, and you are on 25 milligrams a day oral, and that is to lower your blood pressure.
Yes.
You are also on a albuterol, which is a rescue inhaler that is used as needed for your asthma.
Yes.
So, before I start the education process on the newly prescribed medication that you are on, do you have any questions or do you have any barriers that may stop you from, that I may need to help you learn this process more, other than your glasses, because I know you forgot your reading glasses at home?
No.
No?
No.
Are there any cultural concerns that I may need to know of?
No.
Okay, do you have any former prior knowledge to metoprolol or self-injections for insulin?
No.
No? Okay. So the first thing I want to start out with is metoprolol. That you were taking that medication, which is the generic name, the trade name for the medication is Lopressor.
Okay.
So regarding the medication, you are prescribed 25 milligrams a day oral.
Okay.
So regarding that medication, you do want to take it at the same time every day. More preferred with a meal or after a meal. Also with the medication, it is a concern because of the side effects associated with the medication. So you are at risk for falls. Some side effects that are associated with that medication are it lowers your blood sugar, and that is a concern because you are prescribed insulin, which does the same thing. If it's not monitored correctly, if you don't monitor your blood sugar, it can cause death. Okay? So also, the drug works on your body by, it's a beta blocker, and it works in your body by, it works in your body by relaxing your blood vessels, and which decreases your heart rate and decreases your blood pressure. So those are also concerns because decreasing your blood pressure, you are already on a medication that does that, which is lisinopril. So decreasing it too low is a concern and leads to dizziness, lightheadedness, all that kind of stuff, confusion, change in mental status. So it's also a concern. Also, the medication does interfere. Side effect is shortness of breath, and you do have asthma already, so it can cause a flare-up. That is a concern. So if you have any of those symptoms or experience any of those symptoms, please notify a provider. One also concern with the medication is it does cause erectile dysfunction. So with that medication, I just want you to know about that. So you also have to watch your weight with that medication because it can lead to heart failure. And weight gain is a sign of heart failure if it's rapid. So you do want to monitor that. So ways to ensure that you don't fall at the hospital, especially even, is for if you get up, please notify a nurse by your call bell. It's there, so any single time, it's just for your safety. Also, please use 2 side railings that are on the bed at all times to prevent you from falling off the bed. One other thing I would like you to know, do you have any questions or concerns at this time?
No.
Can you please tell me some side effects associated with the medication?
Yes. Low blood pressure, low heart rate, dizziness, lightheadedness.
Mm-hmm. Okay. Are you taking any over-the-counter medication or herb?
No.
Okay. Well, if you choose to, please notify a healthcare provider because it can interfere with the medication.
Okay.
Another thing is storing the medication. You do want to store the medication in room temperature, not anywhere that is too hot or it's too moist, like as in a bathroom setting.
Okay.
Also with the medication, do not take with alcohol because it can interfere with the medication and increase the side effects.
Okay.
One other thing is do not stop it abruptly. It can lead to a heart attack, which is what we are preventing with the medication.
Okay.
So, any concerns so far?
No.
Okay. So, after that, I just want to move on to now the insulin.
Okay.
Okay, so with the insulin, you are taking, I know you were prescribed 2 insulins. Insulin Lisipro, which you have been educated on. Is that right?
Yes.
Okay, so now this one, it requires you to inject yourself 10 units once a day at noon. So with insulin glargine, which is the generic name, the trade name of the drug is Lantus.
Okay.
So it does cause you to have a sub-Q injection, which is like the fatty tissues of your body, which I'll explain to you more in detail when we inject. So the first thing you want to do is make sure you have a clean surface. Also, hand hygiene is very important. I'm going to use gloves. You don't need to, but I do require that you use hand sanitizer or washing your hands. So regarding the medication, it does have to be refrigerated. So you want to take it at least 30 minutes prior to injection out of the refrigerator.
Okay.
So the first thing you're going to do with the vial is move it within your hands.
Okay.
It's mixing the medication. So this is a multi-dosage medication, so there is more than 1 dose in the medication, but you are only taking 10 units at a time. So with that, you are also going to need a syringe, and I also brought a magnifying glass. Okay. So with this, the first thing that you are going to do is then wipe an alcohol wipe on the vial. Then you're going to use a syringe that is 1 to 3 milliliters, and it is also a 23 to 25 gauge by a 1/2 and 5/8 needle. Okay. So you are going to uncap it, leave it on a clean surface.
Okay.
And you are going to take the vial to 10 units of air.
Okay.
Then you're going to use the dominant hand and you're going to inject it. So you're going to wait for it to dry. That's why we did it previously. And you're going to inject it with your dominant hand into the vial, the air. Then you're going to flip the vial and you're going to ensure that the needle is below the fluid line because you don't want it to fill up with air. You're going to go all the way to 10 units. And then you are going to take out and remove all the air bubbles.
Just by flicking it like that?
Yes, just
Okay.
by flicking it. So then you are going to do the scoop method. You never just want to recap the needle because it can cause you harm. After that, you're going to let it sit. You're going to take another alcohol swab. And you're going to clean the area that you choose. So you have the abdominal area, which is, as you can do it in the abdominal area as long as you do it a 1/2 inch away from the umbilical cord, like your belly button. And then you can also do it on the back of your arms, which is kind of hard to reach. So, it does have fatty tissue if you want to. If somebody else was doing it for you, you can. Or if not, you can do it on the on your outer thighs. So you want to do insert it at a 45 to 90 degree angle. Slowly inject it, and then you can take an alcohol swab and massage it. Okay, so you do want to dispose of it at home. You can use an empty laundry detergent bottle and to dispose of the needles.
Okay.
Okay, so any questions so far?
No.
I'm going to ask you if you can demonstrate it for me back. Okay.
Okay. Hygiene. The vial. Air.
Mhm.
That?
Mhm.
Okay. Flip it.
Mhm. That's correct. Yes, 10 units.
Okay.
Okay.
And use a
Air bubbles?
scope method?
Air
Oh,
bubbles?
Air bubbles, I'm sorry. Okay, and the scope method?
Mm-hmm. Okay,
And
perfect.
then I'm gonna do it on my back of my arms, belly.
Yep.
Or thighs.
Yep.
And let
And
the
your
air
outer
dry.
thighs, yes.
Outer thighs, okay.
You're doing it correct.
Pinch. 45 to 90 degree angle,
Mhm.
right? Slowly. Okay.
Okay, do you have any questions or concerns?
No.
Do you
did I
feel
it
comfortable?
okay?
Yes, you did perfect.
Okay.
Okay, so do you have any questions or concerns? Just let me know. But I'm going to take you back to your room, and I'll be at the nurse's station.
Okay.
Okay.
All right. Thank you so much.
You're welcome.